Hello, everyone. Welcome back to Healthcare Experience Matters. I'm your host today, Casey Callanan, podcast director here at the Healthcare Experience Foundation. We have a familiar voice joining us today. She is Katie Owens. Of course, she is the president here at Healthcare Experience Foundation. And joining us as well today, I am super excited to welcome you all to Michelle Brady. She is the Chief Experience Officer with MyMichigan Health. I'm going to have her kind of kick this conversation off by simply just introducing herself and telling us a little bit about what her professional role there entails.
Well, hello, everyone. I'm so excited to be here and to be part of this. I've listened to many of your podcasts, so excited to be with you. So yes, I'm a registered nurse by background. I've been with MyMichigan Health for 34 years, started right out of high school, worked in a variety of roles. Most of my clinical experience was at the bedside in the emergency departments. I've been a night shifter and then started into leadership in a med-surg supervision type of role. And then we're part of a big health system. So we have 8 hospitals serving 26 counties throughout the state of Michigan. So got into leadership in 2 of our more rural hospitals as the director of nursing there. And then most recently, I am the Chief Experience Officer as of 2020 and overseeing all things patient experience related, from the surveys and the data to the patient relations department with grievances and complaints. I also oversee the training and development around experience strategy. And I'm the director of relationship-based care as well, which is our care delivery model. And so I get to weave that into all of my conversations. So that's a little bit about me.
That's great. And I would really, what jumped out at me at that answer was starting your position in 2020, because we all know the significance of that year. And so we might want to touch on that a little bit later. But first and foremost, as an icebreaker, why don't you just tell us something interesting about you, your life, what you do out there in Michigan for fun, or just something that's not on your CV?
Sure. I am one of 7 children. We live in a really small town in Hope, Michigan, so right about in the middle of the mitten. Just an avid sports family. We lived on a farm. I live on some of our family's land still, and love to entertain and bake and have all of my big family around me. That's really when I'm at my best. Or when I'm watching 2 of my favorite TV shows, Schitt's Creek, and I'm a fan of Call the Midwife also. So anyway, probably too much information.
No way, not at all. But now I want to shift it back to healthcare and ask you, your background, obviously very accomplished. You've done a lot for patients over the lifespan of your career and your journey in this field. So what brought you into it, and what kind of keeps you into it? What's your passion? What's your why here?
So I don't remember ever not wanting to be a nurse. Our family was involved in a car accident when I was 5, and actually my father was killed in that accident, and so really got into being around hospitals very young. I had a cousin that was a nurse, and I think that was such a meaningful and formable time in my life, and kind of my role in birth order. I was the baby, and try to comfort folks and keep it light and smooth out the rough spots for people. That was kind of my role. So I don't remember ever not wanting to be a nurse. I really feel that it was my calling to do. My sisters would say I couldn't type, and so I had to go into nursing. So but really it's a calling for me, and it's the connections that keep me there. The connections from being at the bedside, and now those connections with providers, with new nurses, with new leaders, with other professionals, and hearing the stories, right? The stories of people impacted by healthcare providers and nurses. And my son just graduated and has his bachelor's and is working as a nurse on the night shift, and hearing it from his perspective, I think that's what keeps me moving, is all of those connections and the power of those connections.
Every time I've had the opportunity to collaborate with you over the last number of years now, you have just always stuck out as one of the most genuine, authentic leaders. And just to hear some of your personal background, and I can just see so much of how you show up every day with that mindset of compassion and being in it for that true why, because that's just something that can't be inauthentic in being successful in a role like yours.
Thank you.
Michelle, I was wondering, as Casey and I were preparing for this conversation today, and as you and I were bouncing back and forth ideas, I know that communication is such a passion of yours, and that connection and helping staff understand the power of their words. How have you approached using words and language to make a significant impact in patients' perceptions of their care?
So I think it comes from a couple of different spaces, right? I think when we look at the patient's experience, that being the memory of it that they take with them, right? And as a leader, we come up with scripts and tactics, right? And strategies. Often I hear, Michelle, what's our strategy? What's our strategy? Well, I can give you best practices, right? From, the greats of Quint Studer and keywords at key times and all of these best practices. And what I've found is folks come to me then and they'll say, Michelle, we're doing everything you gave us on the list, right? We're still not moving the dial. And then I'm like, okay, how are you doing it? How do you show up? And as we watch and we mentor and we talk and have these conversations, it's an aha to me. It's not what we're doing, it's how we're doing it, right? And the words that we use and how we say the words, right? So, I think about patients coming into healthcare at a very vulnerable space, right? And they're craving connection. At that time, they want to connect. When I think about folks in those vulnerable spaces throughout my career, personally and professionally, when you're waiting for an update, right, from the doctor, from the nurse, from somebody, and you hang on every word they tell you. Right? And you're searching for the good, what was the positive in this? So for me, first, it's laying that out there, and it's the awareness and using some of my personal stories to say how much these words impacted us, right? So then you take a deeper dive and you say, well, what are those words? And what are the words that make a difference? And I think it's not only the words that we use with patients and families, but it's the words we use with our teams that we're leading that really have to be at the first level.
Yeah, I think that's so important. I was just with an organization, and we were working on some improvement strategies, and as we were going from patient room to patient room, what you said to me is just so profound, because what caused the greatest degree of anxiety was the conversations that they were hearing happening at the nursing station. And so how do you, I've had the opportunity now to work with you in MyMichigan, and how do you, across such a diverse network of member hospitals and different communities, how are you working alongside the leaders, staff, and the physicians to be more mindful in the words that we use, and honestly, the words that you probably work to eliminate from the vocabulary?
Right. So just like this morning, prior to this, I have the opportunity to sit with all new leaders in our health organization and spend some time talking about our patient experience goals and our care delivery model. And part of that conversation includes the words we use. And one of my big kind of sticky wickets, or I don't know what you want to call it, is when we say, oh, the frontline staff, right? The boots on the ground. They're in the trenches. And that's how we talk about our staff, right? Okay. Those folks, and I have a slide that shows, men in a foxhole. Those folks are fighting an enemy, right? Yeah. They're at war. And if we refer to our team members, our staff, as frontline, in the trenches, boots on the ground, then guys, who does that make the patients? That makes the patients our enemy, right? So for me, it's starting to have this conversation. I have this conversation now with new leaders, more over just the last 6 months.
Mm-hmm.
And now when I meet with new nurses and transition to practice, I start to talk about that. Like, don't you want to be a professional, right? You're the first line staff. Mm-hmm. You're the direct caregivers, right? You are at the bedside, right? You're not in the trenches in X-ray. You are the person performing the imaging that will determine someone's course of treatment, right? How do we think about ourselves? And we think about a workforce that's burnout, been through a pandemic, right? Been through this social polarization. Mm-hmm. That we have to be careful of how we talk about ourselves, or we start to believe it, right? And so I think for me, I'm on kind of a mission to raise just the awareness, right? Those words matter. How we talk about our staff, and then how we talk about the patients, right? Can you call them by their name instead of their room number? It's very simple, right? Key strategy, right? and using words like, I'm here for you. Mm-hmm. My name is Michelle. I'll be your nurse for the next 12 hours. I'm here for you.
How about that for reassurance at a time when 96% of patients have great fear?
Right. I've got your back. Oh, who do you have with you? Oh, this is your daughter, Katie. Katie, just so you know, I'll be your mom's nurse today. I'll be back tomorrow. I've got you. Right. Mm-hmm. I can say, my name is Michelle. I'll be your nurse for the today. Let me know if you have any questions. Right. It just feels different. Mm-hmm. It just feels different.
It absolutely does. And it role models, and everybody wants to be a part of the winning team, and they want to know that they have the best team taking care of them, because at the end of the day, they are the most important person walking through your doors in their lives and in their families. And Michelle, something else that you just said that I'm going to pre-ask you to rejoin us about, because what you're describing is something we're working really closely on, which is the intersection of health equity and the experience. And even some of these points around being mindful and reducing, which is a journey for me, the violent language in our vocabulary. And how are we meeting people where they're at in a way that they can understand and validate, and being sensitive to the things that we say, the things that we chart about, because it carries such a wake forward, and that violent language produces stigma.
Yes. So our organization, our care delivery model, like I said, is relationship-based care. Mm-hmm. And part of that is, attuning, wondering versus judging, being really aware of what are my implicit biases? What's the lens in which I look at things through, mm-hmm. right? And my lens, my glasses work for me, but if you put them on, they might be really blurry, right? It doesn't make them bad. It's just my lens. And I have to be really aware that your lens is different than mine. Right. And part of being a good clinician is being aware of what are my biases, right? And, I got to caution myself. I need to be aware. And, I encourage our nursing staff to say to a patient or a family, what matters most to you today? I encourage the providers at the beginning of their interaction. What's on your mind? What were you worried about last night? And to try to make it more about them and what their agenda is and what's important to them. Because if I don't know what's important to you, and I don't at least ask what I think is important, you're not going to hear. So
that respect for everyone's worldview and that person-centered care, and how extraordinary that you have the opportunity to connect those dots and impact so many lives.
Really try. Sometimes I feel like I say I'm like a Rottweiler trying to get through the cat door. I'm trying to just listen to me. Just give me 2 minutes, right? So
just that analogy is so powerful right there. Yeah. I'm getting all of our listeners right now can just see that imagery.
Sure.
Definitely. And one thing I always like to ask at the end of these interviews is just to make sure we've covered all our bases. Was there anything else that either one of you, Katie, Michelle, wanted to mention about what's important in this discussion when we're talking about being mindful when interacting with patients that we just maybe haven't mentioned yet, or anything else valuable that you wanted to leave us with?
I would like to add two things. One is that it's all about relationships, right? And if we can, in the moment, whether it's that short bit of time in the ER, or a longer stay, or your provider, your long-term provider, it's the relationships that we make with folks that create kind of that buffer and that margin. Because in healthcare, when we do miss the mark, or there is a delay, or there is a complaint or a grievance, if we've taken just a little bit of time and are aware of how we show up with folks and the words that we use, those relationships can create a margin or a buffer for error, for when we give us some grace. Patients are much more likely to give you grace if they really felt you cared about them. And I think that's so very, very important and cannot be understated. The only other thing I would add is that what I ask of folks doesn't take any more time. This is just how you show up doing the work you're already doing. This is not an additional thing. This is just about how you show up. And there's always time to provide some comfort to someone, whether it's your smile, your eye contact, a hand on the shoulder, flipping the pillow over to the cool side, whatever it is, you have time for that. And those are the things that matter. So thank you for asking.
Oh, no question about it. This discussion has been definitely a powerful one. We've been joined by Michelle Brady. She's the Chief Experience Officer with MyMichigan Health. And we've also been joined, of course, by Katie Owens, who is the president here at the Healthcare Experience Foundation. And just want to thank you both for your time this morning. This has just been a really great conversation. I'm excited to get it out to our listeners.
Awesome. Thank you so much.
Thank you, Michelle. And thank you for showing up every day with this drive and energy to make healthcare better.
Thank you. Appreciate it.